and Meryem will start with talking with us about diabetes and current standards of care. So with that, I will pass the floor to you, Meryem, and away you go.
Thank you, Andrew. Thank you. Hi, my name is Meryem. I am a dietitian and also currently a PhD candidate and doing my research on type 1 diabetes, low blood sugar, and technology. And today I will be talking to you a little bit about that. So blood sugar or blood glucose levels are continuously moving, and they're continuously moving throughout the day, depending on what we're eating, how we're moving, how we're feeling even. So for sometimes it could go high, sometimes it could go low, and sometimes it could go way too high or way too low. But most of us, those who don't have diabetes, specifically type 1 diabetes, we have a functioning pancreas that is working 24/7 to provide that regulation needed to keep us within the normal blood sugar or blood glucose level. However, unfortunately, some people do have a pancreas that either does not work or has been destroyed. And those people usually have type 1 diabetes, which is an autoimmune disease where the body attacks the pancreas cells that make insulin, which I will talk about a little bit later. So those people who don't have that the insulin, or who don't have a pancreas that can regulate for them 24/7, they cannot do that regulation easily or at all. So they need to have an external insulin given to them in order to help them to stay within the normal levels. However, if they don't take that insulin, or if they don't take enough of it, or if different life factors can change, either as I mentioned earlier, food or activity or even stress, their blood sugar levels will be out of whack in a way, and they could even go too high, go too low, and all of these different variations come with consequences. So the condition that I'm mostly interested in is type 1 diabetes. As I mentioned earlier, it's an autoimmune disease. It can happen to anyone, and it's the pancreas no longer makes that insulin, and up to very recently it was a deadly disease, and a lot of kids died because of it. And up till about 100 years ago, we were able to find out that if we inject insulin, it does help with regulating the normal blood levels. So the goal or the aim of this treatment or of this therapy, which is insulin therapy, is to bring the blood sugar levels from being too high. Because again, if the person does not have a functioning pancreas and they don't have insulin, the blood sugar does not have a way to go inside their body cells to be used, so it just keeps rotating around, and they end up having high blood sugar levels. Constant high blood sugar levels over a long period of time can lead to many of the complications that we know of diabetes, such as heart conditions, blindness, kidney failure, or even amputations. So the importance of taking insulin and managing lifestyle intensively stems initially from wanting to keep blood sugar levels low or within the normal level. However, the scary long-term complications that most of us, or those of us who know more about diabetes or know something about diabetes, associate with this condition also exists in a continuum with the other side, which is the low. However, the long-term complications, as I mentioned, can happen over a long term. So that means that they can happen in 5, 10, 15, 20 years. So when we first learn about the condition, when we first learn about the diagnosis, or if I was to talk to you right now and say that maybe if you were to know about this condition and if you were to be told about diabetes, the first thing that you would think about would be the long-term complications, because they're very significant. However, if I tell you that while trying to treat or to avoid these long-term complications, we also put the person at a risk for the other short-term complications, which have to do mostly with the low. So a low blood sugar, on the other hand, is a side effect not of the disease itself, but of the therapy or of insulin. And it can be caused by many different combinations as well that are sometimes, or most of the time, really are out of the control of the patient or the person, and it can happen abruptly and sometimes when it's least expected. So the low blood sugar, when it happens, it has many symptoms and complications in itself, such as headaches, nausea, having difficulty concentrating or speaking, and those instances can happen very frequently, or they can also advance to being severe or more severe than what I just mentioned, and can even lead to can even be deadly. So this low blood sugar levels, they are a consequence of now. They happen now, and they can be They can be even happening multiple times a day. So in the person's mind, who, if you had to live with that sort of complication, worrying about now for some people becomes even more important or more pressing than what might happen in 5, 10, 25 years from now. So this monster that I'd like to call the low blood sugar monster, it feeds on the person's experience with lows, especially if it's frequent. It fears on that fear, it feeds on the fear of social stigma, because again, if you cannot concentrate, or if you're feeling dizzy or nauseous, you might seem a little bit off to the person who's next to you, who does not maybe know what diabetes is. So that fear, that social stigma that comes with diabetes as well, that diabetes is always seen as a disease that you get because you ate too much sugar or you did not take care of yourself, when in fact diabetes can happen really just as a stroke of bad luck. This social stigma that comes with both diabetes and low blood sugar experience is also can also create fear in the person living with diabetes, and most importantly, the lack of information on what's going on in one's body. So as I mentioned earlier, for people like you and I who have a functioning pancreas, the pancreas takes care of managing all of that stuff, right? So it has its own sensors, it knows how much insulin to make and how much to secrete. However, if our pancreas is not in the capability of making that insulin or of handling and regulating the blood glucose levels or the blood sugar levels, we have to take on that job. And we don't know what's always going on in our body, especially if we're talking about the conventional treatment methods where you only prick maybe 2, 3, 4, 5 times a day, and you only get a snapshot of what's going on in your blood at that specific time. So you don't know all the fluctuations that happen. Or if you take your insulin, you probably take insulin maybe 3, 4, 5 times a day. Again, it's not the same as the pancreas that is continuously doing it 24/7. So that lack of information and that lack of flexibility as well also feed that monster that is, as I mentioned earlier, the low blood sugar monster. And this monster really is so scary to some people that they fear it, or they're scared of it far, far, far more than they are scared of the long-term complications. So they would be scared of what's going to happen today or tomorrow or the day after, more than you would be scared of something that's far down the road that is still far away. So for those people, they would choose to keep their blood sugar higher than recommended, of course. And they would choose also to either overtreat their lows, avoid insulin or not take their insulin, and put themselves at a higher risk for those longer term complications, just to avoid the short term complication, which is the low blood sugar. And all of this, again, will make them will have a negative impact on their overall diabetes management and mental health and quality of life and all of that. So, however, now we have some technologies, the era of technology, and everything is becoming more automated. So we do have some diabetes technologies that do or can help with managing blood sugar levels. Mainly, we have the insulin pumps that you see is here. So the person no longer has to prick no longer have to inject a syringe or a pen of insulin themselves. They can have a little device that they wear, and this device will continuously infuse insulin into their bodies in a similar fashion to the pancreas. And we also have continuous glucose monitors. And again, these are little sensors that the person can wear for 14 days, 7 days, 10 days, depending on the model. And these will read what the glucose or what the sugar levels are in the person's body and give them that information in a continuous manner. So these technologies do give us real-time information that is very valuable, and they also provide more flexibility in insulin administration to allow the person to remain within normal level or normal values. However, unfortunately, just because these technologies are available does not mean they're accessible. Many people who need these technologies cannot have them because they cannot afford them, and they're not always covered by public insurance. So my work really focuses on wanting to explore these technologies, mainly by exploring their effect on hypoglycemia and the fear that comes with hypoglycemia. And I want to provide or add actually to the evidence that is being created currently around the importance of providing access to these therapeutic technologies as a part of usual care. And in order to do this, my work uses data from the Better Registry, which is an online registry for people who have type 1 diabetes here in Quebec. It has been launched in 2019, and it is really focused on patient-reported outcomes and self-enrollment. So we have 3 online questionnaires that the participants or the patients either fill them out for themselves, or we have also a questionnaire for parents of kids who have type 1 diabetes. As I mentioned earlier, type 1 diabetes can happen at any age. It does not come with what we usually associate type 2 diabetes with, and only adults, but it really can happen at any time. It can happen mostly see it in kids, but now we also see it in adults as well. So we want to capture all of those, the entire really population that has type 1 diabetes in Quebec. And we have 3 phases or 3 questionnaires. So we're really interested in looking at the general portrait of the population first, understanding who this population is, and mostly focusing on their experience with technology, what technology they're using, if they're using, we're also looking at their socioeconomic status, the diabetes management as well, and specifically low blood sugar management, their confidence around low blood sugar, their fear of low blood sugar, and different well-being and quality of life as well. And we also, as I mentioned earlier, we have it for kids and for adults as well. So what I am mostly interested in the data that is provided to me by the project, mostly looking at the extent of the burden of low blood sugar, looking at the strategies used by people with type 1 diabetes in Quebec to avoid low blood sugar, either during the day or at night or after physical activity, and also looking at the impact of adding a diabetes technology on the low blood sugar or hypoglycemia. And in addition to the registry that my data will be collected from, we also have a support platform, which is an online platform or an online training platform for people who are living with type 1 diabetes in Quebec to provide, again, support for them and around not only the use of technologies, but also around everything that has to do with type 1 diabetes, because we feel that there is a lack of support in that sense. And what we're really trying to do here is build a case for the need or provide evidence for the need to have accessibility to these technologies, but we can't do that without understanding the population first, and we need to understand their clinical needs so we can have a better targeted care. We also want to understand the impact of these technologies on reducing the burden of diabetes in general, but specifically on low blood sugar and the burdens that come with it, such as the fears. And we also want to provide evidence and support the importance of providing access to these therapeutic technologies and really to make it available and accessible to people who need it. Now, all of this, at the end of the day, the goal is to provide all the tools, all the knowledge, all the information, and all the support needed to people with diabetes, either type 1 or type 2, to allow them to get rid of all the obstacles and monsters that affect their daily life and their health. Now, these technologies do provide more support to people with diabetes, allowing them to remain within the normalized blood sugar levels and avoid the big swings between the highs and lows that have detrimental consequences to their health, as I just mentioned. And this is really our goal. Yes, we can fluctuate between a little high, a little low, but as long as we stay within, or as long as we can stay within that normal level, we can avoid those complications. And we believe that having access to these tools far outweighs the costs, because not only is it going to be beneficial to the person themselves, improve their health outcomes and quality of life for them and for their families and for their loved ones, but it will also help our society as a whole reduce diabetes-related healthcare costs, for example, and just improve the quality of care provided. And with this, I'd like to thank you for your attention, and I hope you enjoyed the presentation.